Good afternoon, everyone. The Chief Medical Officer and I will take questions shortly. However, I want to firstly give an overview of where we are with COVID, and I'll start with today's statistics. 4,323 positive cases were reported yesterday, and that is 14.5% of all tests that were carried out. 364 people are currently in hospital, a rise of 8 since yesterday, and 43 people are in intensive care, which is 2 more than yesterday. Sadly, a further 10 deaths were reported in the past 24 hours, and that takes the total number of deaths registered under this daily measurement to 8,080. As always, my condolences go to everyone who has lost someone as a result of the virus. I'll also give a quick update on the vaccination programme. As of this morning, 4,085,552 people have received the first dose of vaccine, and 3,587,145 have received a second dose. Around 80% of all over 18-year-olds have now had both doses, and that includes 95% of over 40s. So these are genuinely remarkable uptake figures. 82% of 30 to 39-year-olds have had a first dose, 68% have had so far both doses, and for the 18 to 29-year-old age group, 74% have now had a first dose and 41% have had the second dose. As you know, 16 and 17-year-olds started being offered vaccination a couple of weeks ago, and already 40% of them have now had a first dose. So there's no doubt uptake figures are exceptionally good, but, and I want to stress this point, there are still eligible people out there who are not yet vaccinated, and that does pose a risk to you if you are one of them, and indeed to all of us, because it means that our overall level of population immunity is not as high as it could be. So if you are 16 or over and haven't yet done so, please do get vaccinated now. You just need to turn up at a drop-in centre. You can find out where the centre nearest to you is by going on to the NHS Inform website or check the social media pages of your local NHS board. Now, there's 2 further issues I want to cover today by way of introduction. In a moment, I'm going to discuss in a bit more detail the overall course of the pandemic, including, of course, and particularly, of course, the sharp rise in cases that we've seen during the past week. But before that, I want to confirm an announcement that has been made just within the last half hour or so. The Scottish Government has previously committed to the establishment of a statutory public inquiry into the handling of the pandemic. And today we have started the process of getting such an inquiry up and running. I can confirm that it will be established by the end of this year as promised, and it will take a person-centred, human rights-based approach. We have this morning published draft aims and principles for the inquiry, which following a period of consultation which will take place between now and the end of September, consultation with interested parties, including, of course, bereaved families, these aims and principles are intended to become the basis for the formal terms of reference of the inquiry. A copy of the draft and details of how you can contribute your views if you wish to do so can be found on the Scottish Government website. I can also confirm that the Lord Advocate has begun discussions with the Lord President about appointing a judge to lead the inquiry. It is fully our intention that this will be a judge-led inquiry. The inquiry will look at all matters related to the handling of the pandemic that are within our devolved competence, and this will include, of course, the situation in our care homes. However, we will also liaise closely with the UK Government and other devolved governments on the likely terms of a UK-wide inquiry, where possible, not least to reduce the burden on those who will give evidence to these inquiries. It will be important to avoid duplication and overlap. However, the need for cooperation with other governments is not, in my view, a reason to delay the establishment of our own inquiry. I do believe that a full public inquiry has an extremely important role to play, both in scrutinising the decisions we took and indeed continue to take in the course of the pandemic, but also, of course, in identifying and learning appropriate lessons for the future. I therefore believe that it is appropriate to establish that inquiry as soon as possible now, and the process we've begun today is an important step towards that. Now, the second point I want to address is the sharp rise in cases that we've seen in the past few days. New cases in Scotland have more than doubled over the past week, and that is one of the sharpest rises we have experienced at any point during the pandemic. As a result of that, new cases are now slightly higher than the very high levels we saw in early July. In fact, today's daily figure is the largest we have ever recorded in a single day, though it is worth remembering, and I think it's important to mention this for context, that we do more testing now than was the case certainly in the early stage of the pandemic. Now, we always knew that cases were likely to rise as restrictions eased, and you heard us say that from these platforms in recent weeks. So to some extent, what we are seeing now is not entirely unexpected. That said, the scale of the increase is still a cause of real concern. Although again, context is important. We know that vaccination is making a big difference. Indeed, that explains why so many of the new cases we're seeing just now are in younger people who are less likely to have had both doses of vaccine at this stage. Around half of all new cases are right now in people under the age of 25. We shouldn't be complacent about that, of course. Young people can still fall seriously ill from COVID, including, of course, through long COVID, which is something that is still to be fully understood. And of course, vaccination, while hugely effective, doesn't provide anyone of any age with 100% protection. In fact, around a third of new cases recently have been in people who have had both doses of the vaccine. However, vaccination does make all of us somewhat less likely to get COVID, and it makes us significantly less likely to fall seriously ill from COVID. That means vaccination is still significantly weakening the link between high numbers of new cases and serious harm to people's health. And of course, that's why we are able to take a different, much less restrictive approach to dealing with the virus now than was possible in earlier stages of the pandemic. And it's worth remembering why it is so important for us to do so and to seek to continue to do so if at all possible. Children need to go to school and learn and interact with their friends. Businesses need to trade more normally. That's important for our economy. And of course, jobs rely on businesses trading as normally as possible. And all of us, for our mental health and well-being, need to be able to live more freely, to interact as close to normal as possible with our friends, family, and wider networks. So vaccination is helping us do all of that, and that is a good and a positive thing. But this is the more difficult part for all of us, even with vaccination, we can't be totally relaxed about this surge in cases either. The link between new cases and serious health harms has weakened significantly, but it has not been completely broken. That means the rise in cases in the last week may well result in more people having to go to hospital in the coming days, perhaps requiring intensive care treatment. And unfortunately, a rise in cases like this will still lead, I consider likely to be the case, in an increase in numbers of people dying. And that also means that if the surge continues and if it accelerates and if we start to see evidence of a substantial increase in serious illness as a result, we cannot completely rule out having to reimpose some restrictions. Of course, we hope not to have to do that, and if we did, we would be as limited and as proportionate as possible. However, as has been the case throughout so far and up until this point, what happens in the next few weeks will depend, to some extent, to a large extent, on all of us. This is yet another fragile and potentially very pivotal moment in our journey through this pandemic. And it is a moment to remember that even though most restrictions have now been lifted, the virus is still circulating, and we know that the Delta variant is highly transmissible. So we need to continue to take care, and we need to think about how, in our own behaviours, we can limit the ability of the virus to spread. Indeed, in some ways, the basic precautions we can all take have become more important, not less important, as life has returned so much more to normal. So I'm asking afresh today for everyone to do the following for the sake of ourselves and each other. First, as I've said already today, but I'm going to stress it, if you are eligible and haven't yet done so, please do get vaccinated. This remains the single most important thing, most powerful thing we can all do to keep each other safe. But the reverse of that is equally true. Not getting vaccinated is putting yourself and others at greater risk. Second, please test yourself regularly. That way, if you have the virus, but if you don't have symptoms, you have a chance of picking that up before you might go to work or go out socialising and inadvertently pass the virus on to others. Free lateral flow tests are available by post through NHS Inform, or you can collect them from test sites and local pharmacies. And if you test positive through one of these devices, or if you have symptoms, make sure that you self-isolate and book a PCR test. Third, stick to the rules, albeit a very small number of rules that are still in place. For example, do wear face coverings in shops and public transport, in other indoor settings where that is required. This is a reasonably simple and straightforward way in which all of us can try to protect each other while in indoor settings. And lastly, be mindful of the basic steps we can take to reduce risk. I think all of us perhaps have been drifting back to normal, but this is a moment to remind ourselves of the basic steps it's important to take. Wash your hands and wash surfaces as regularly as possible. Even though it's not the law anymore, try to keep a safe distance from people in other households if you can. Try to limit as far as possible the number of unnecessary contacts you're having. Continue to minimise direct physical contact where possible, like handshaking, for example. Avoid crowded indoor places and meet outdoors as much as possible, especially for as long as we have reasonable weather. And if you are indoors, try to open the windows. The better ventilated a room is, the safer it will be. It's vital at this juncture that we do remember to do all of these things. As we head into autumn and winter, that's going to be increasingly important. And of course, as we head into autumn and winter, these basic steps, as well as, I hope, as helping us to limit transmission of COVID, will also help us limit spread of flu and other viruses as well. Now, in the coming days, we'll also be liaising with businesses to encourage compliance with basic mitigations. In particular, I'm today reminding businesses to continue to support home working for now, where possible. We have come a long way in our journey through this pandemic, and it's important that we don't lose sight of that. In so many ways, because of vaccination, things are better. But like other countries in what is a global pandemic, we once again face a challenging and fragile period ahead. So let's come together again to help each other through it. Let's keep ourselves and our loved ones safe by following all of the advice I've just set out. And let's work to maintain the progress that we've all worked so hard for. So thank you for those of you who've joined us again for listening. And remember, it is within the power of all of us to limit the transmission of this virus and play our part in keeping ourselves and others as safe as possible. I'm going to move now to questions. And as I said earlier on, the Chief Medical Officer has joined me. I should say, we are joined by a small number of journalists in the room today for the first time in almost 2 years, in fact. They are all physically distanced. We're maintaining that. Most of the journalists will still be joining us online. But it is important, where possible, to have journalists with the ability to question us directly in person. So that's why we've taken this very careful and limited step to reintroducing some normality to our press conferences, just as we've tried to reintroduce some normality to life generally. So first today, and indeed in the room, I'm going to go to Lindsay Bewes from the BBC.
Thanks, First Minister. You talked about infection levels being a bit of a cause for concern. Now, that's before we've seen the impact of schools going back, of university students going back. So I wonder what your projections are for cases continuing to rise over the coming weeks and months, and what will the tipping point be for the impact on the NHS when it comes to looking at perhaps the reimposition of some restrictions. And just secondly, a question on the inquiry that you talked about establishing by the end of the year. You said that you didn't want to delay starting that. I think what will be really important to the families of those who've lost loved ones will be the timescales around that inquiry. Can you say much more about when you would expect that to run for and when it might conclude?
Thanks, Lindsay. I'll take that question first of all, because I think I can be relatively brief there. I'll also address your first question as briefly as possible, but the Chief Medical Officer will want to say more there too. This is an inquiry that will be established under the 2005 Inquiries Act. It will be a statutory, and as I said in my opening remarks, our intention is that it will be judge-led. Under the Inquiries Act, once an inquiry is established, the terms of reference are set. It is, of course, for the chair of the inquiry to determine exactly how it operates, because it's important that it operates independently. We may well, in the terms of reference, although we haven't decided this yet, give an indicative sort of estimate of the timeline we would like to see the inquiry completed in, but there's some discussion to be done there. But as you will know from previous public inquiries in recent times, a chair of an inquiry can always ask for that time scale, if one is set, to be extended if they require longer to conduct their work. So once the inquiry is established, the operation of it, the conduct of it, who it takes evidence from, who gets core participant status, and ultimately how long it takes to do its work are in the decision making of the chair and any inquiry panel that might be established. On the first question, we've, as recently as this morning at Cabinet, been looking at all of the possibilities for the trajectory over the next weeks and what that may mean for hospital capacity and intensive care capacity. It's always really difficult to be definitive about any of this because none of it is static. Obviously, as I was trying to say earlier on, there's things all of us can do to try to slow down transmission, which then has an impact on what we will see in reality. In terms of hospital admissions and people becoming seriously ill. I think there's 2 points that it's important, well, I'll come on to make 2 substantive points very quickly. The preface to that, though, is to say we are monitoring this, as we have done all along, but clearly at points like this where things feel very fragile again, we monitor particularly closely. And if decisions are required, we will take these decisions and communicate these decisions. I think the 2 points I would make about hospital impact, firstly, and you've heard me say this many times in recent months, there are far fewer people getting COVID who are ending up in hospital than was the case earlier on, and that's because of vaccination. So it tends to be younger people in the main who are getting COVID just now, although we can't be complacent about that seeping into other age groups. Younger people can get seriously ill, but if they're vaccinated are less likely to get seriously ill. So we're seeing that weakening of the link between cases and hospital treatment, but this is a point I remember making often earlier this year. If cases are really high, even a smaller percentage going into hospital is still a big number going into hospital. So that causes us real concern. And the second point is our NHS is trying to get back to normal. It's very, very busy with non-COVID care now. I will launch with the Health Secretary the Nhs Recovery Plan tomorrow morning, in fact, which will set out exactly what we're trying to do to catch up on backlogs, treat demand that might have been suppressed during the pandemic and is starting to emerge now. So the margins of tolerance for our NHS to deal with COVID are much smaller than they were at the start of the pandemic, when we effectively cleared the NHS, apart from really urgent care, to deal with COVID. And indeed, that's why we've got a backlog. So it will take less now than it would have done at the start for our NHS to face quite significant pressures and significant difficulties. So all of these things we have to be very mindful of as we try to navigate our way through this next difficult period. And you're rightly saying, this was my last point before handing over to Gregor, all schools are back now, but schools have not been back for that long, so we do have the possibility of continuing to see that effect feeding through into our case numbers over the next few weeks. So, as I said earlier on, really fragile moment, really pivotal moment, but coming back to the central point, none of us are powerless against this. If we just try to firm up on all of these basic precautions, hopefully we can have an impact on slowing things down.
Lindsay, as the First Minister said, we're in a fragile moment just now, and I think it's a fragile moment, but one that collectively we can still influence, and that's really important, because by taking the steps just now to make sure we maximise the uptake of the vaccine, particularly in those younger age groups, by making sure that we are testing regularly, that we are thinking about the contacts that we have with other people, and perhaps being a bit more cautious with those, so that we're limiting those contacts compared to the last few weeks, that we're making sure that we're taking the simple measures just now, we can still influence the case rates that we're seeing just now. And we've become used to looking at these case rates and making an assessment on those, but the vaccines have changed that context for us. And so it's really important that, as well as taking notice of those case rates, we look at the harm that's occurring within the system, particularly that harm as it requires further NHS care, whether that be because of severe disease, long COVID, or any of these other sequelae of the infections themselves. So we'll be monitoring very closely that infection data, but particularly with a mind on how that translates through to the more severe types of illness. Now, at this moment in time, 70% of the illness that we're seeing, just now, of the cases that we're seeing, are in the under 40 age group. People can still become more severely ill in that age group, but it's much, much more uncommon for them to become ill. We'll be keeping a careful track on whether there's any movement in the proportion of infections and cases in older people, and how that's translating through to the requirement for further care, particularly in the hospital setting. And it's only through looking at all this data together that we'll be able to make an assessment as to the timing of, if any, further measures are needed to try and slow down things. But I go back to my original point, we still collectively have the ability to be able to influence this just now, and we should take that opportunity while we can.
Thanks. Gordon Cree from SAV, also here in person.
Thank you. You've said a lot about the need for people to reduce the risk, but if you think this time last year, there was a kind of feeling that we were all in it together, but now things seem more polarised between those who feel it's largely over and are living life as normally as possible, and those who might look at the case numbers in isolation and be terrified. So how do you kind of reconcile the two groups to work together to keep the figures down, if you will? And on hospitals, colleagues were filming last night in Lanarkshire, and were told by an A&E consultant there that across the 3 Lanarkshire hospitals, only 60% of A&E patients are being seen, assessed and admitted or discharged within 4 hours. And they're saying that this isn't specifically due to COVID. These are not COVID patients, it's the build-up of a backlog of things getting out of hand. And they're saying this is day after day, and some of them feel like the system is broken. Now, I know you've got the recovery plan tomorrow, but people working there, living this day by day, they just feel that they've just been abandoned.
Absolutely not been abandoned, and I'll come back to that point in a moment. In fact, the Nhs Recovery plan talks in quite some detail, as you will see tomorrow, about the steps we need to take to support the workforce and help the workforce to recuperate and recover as well. But I'll come back to that point briefly shortly. On the first point, look, we're a year on since the point last year that you described there of everybody feeling they were in it together. People are fatigued, tired. People are worried about jobs in some respects. People have gone long periods of time without having normal interaction with loved ones or being able to do the things we all enjoy. And people have come forward in the main in large numbers to be vaccinated. There is an understandable desire just to have me stand here and declare it all over, and we can stop worrying about it. And just to reassure people, there's nothing I would like more than to do that. But this is a global pandemic. It is accelerating still in parts of the world. Delta is so much more transmissible than even Alpha, which, if you remember at Christmas, we were saying was so much more transmissible than what had gone before. It's a virus that will continue to do its best to beat us. And therefore, we've got to make sure that we stay vigilant. I don't underestimate, though. I've tried never to underestimate this, but I certainly don't do it now, how difficult this is. But nobody can wave a magic wand and make it all go away. So how do I try to get people to continue to do the right things and continue to pull together? I think I'm lucky in that I know the majority of people in Scotland, however frustrated they feel, want to do that. And I will continue, as I've tried to do at previous stages of the pandemic is to set it out as clearly for people, to set out the basis for our decisions, but also say this is what we can all do to come together and try to get through this next stage. Things are, I can't even bring myself to think how bad things would be right now if we didn't have a vaccine. We do have a vaccine, and that is shielding us a lot, and it's shielding the NHS a lot. But even so, this virus will try to beat us in every way it can. So what am I now asking people? I'm not asking you yet. I hope I never ever have to ask you again to stay at home all the time. But I am asking you to wash your hands regularly, wear your face covering when you're indoors. Just be sensible about distance. Don't shake people's hands. Try to minimise contact. None of us want to live like that, but compared to what we've had to put up with in the last couple of years, these are much more basic mitigations than it was the case previously, and they will make a big difference. On the NHS, you're absolutely right in what you set out. What we're seeing in our NHS is a lot of people who previously in the pandemic would have chosen maybe not to come forward with symptoms because, well, it's been more difficult to get face-to-face interaction with a GP, for example. And some people were scared to go into these kind of settings. People were following advice to stay at home. So we're now seeing demand in the NHS that has been suppressed coming to the fore, on top of the backlogs of known demand that we're already dealing with. The situation in our NHS is incredibly difficult, and I'm not going to be glib here and stand and say thank you to the staff, because it is right that I do and show that appreciation, but it takes more than that. It's also the case that the NHS is a very complex but interlinked organisation. So one of the things we need to do, and this is not easy, to get pressure on A&E down, is to get primary care services back to normal so that people have more face-to-face interaction, because sometimes people will end up in A&E because they don't have the ability to see somebody elsewhere, and there's a programme of reforming urgent care underway right now. So none of this is easy. I don't underestimate the difficulty for those working at the front line of our NHS, but it is essential that we get ahead with the recovery plan, and I'll say more about that tomorrow. Final point before handing over to Gregor is, when we stood here 18 months ago, protect the NHS was part of what we asked everybody to do. We still all have a part to play in protecting the NHS. Every person who ends up in hospital with COVID, it's a hospital bed that's not there for somebody with a known COVID reason, and it's added pressure. So if we're all behaving in a way to minimise, if somebody who gets COVID is not to blame for getting COVID, it's nobody's fault. But if we all act in a way to minimise that, we will all collectively help to reduce that pressure, and that's another reason why that's so important.
So I still have regular dialogue with colleagues across the service, whether that is in emergency departments, as you described, whether that's in GP practices or in the public health teams, who are still making sure that they're providing that level of care that people need. And that unmet demand that's within the system just now is something which is leading to some of these real significant challenges for people. At this moment in time, what we see is very complex, ill people arriving within the kind of front door to hospitals in particular just now. And my colleagues are responding to that and making sure that those people are getting the care that they need. But because of the complexity of the care that's required, it takes longer for them to do that. And as I say, we're working our way through that just now. The recovery plan, which we are producing and which will be published tomorrow, will give further detail on how we can respond to that over time and making sure that we're responding to that unmet need in a timely way. But for this moment in time, we can all play our part to make sure that we can help my colleagues by reducing the opportunities for COVID infection to impact on the care that they need to provide to other people as well.
Do you have talk from Sky? My apologies, Sky are not joining us. And so the next question is Gregory Hoare from ITV Border.
Thank you, First Minister. The case rate is surging in Dumfries and Galloway, and in the Scottish Borders, routine operations have been suspended until the 5th of September. The NHS there is clearly under pressure. How concerned are you? And the question in the minds of many people there is, at what stage could we see some restrictions reintroduced?
Thanks, Gregory. Case rates are rising sharply in Dumfries and Galloway, but they're rising sharply right now in not every single part of Scotland, but in most parts of Scotland. So it's a concern overall. And as you've rightly set out there, that is having already an impact on some hospitals in some parts of our National Health Service. I don't, I'm standing here being pretty frank with people about the seriousness, potential seriousness of the situation we face again, but I fervently hope we don't have to go backwards and impose more restrictions. What I'm saying candidly to people is, if we have to do that, if we feel that is necessary to protect the country, of course, I won't shy away from those decisions, but I don't want to have to do that. And Gregor said a moment ago, and this is the point I think to reiterate, we all have a chance to influence this just now. I think all of us, and I include myself in this, as things have got back to normal, we do forget sometimes about the basic mitigations, and all of us desperately want to be able to forget about them, but we need to just remind ourselves. This is a moment to kind of take a pause and remind ourselves this virus is still there, and do the basic things that can stop it spreading. So that's what I want to focus on. It's what I want to try and focus everybody on. And if we do that, and if we get the situation back to a level that is more under control, then hopefully, I really mean that, we will not have to reimpose any restrictions. But this is what we're going to have to judge and monitor in the days and weeks to come.
I spoke to the medical director from Dumfries and Galloway on Friday afternoon, and he updated me exactly on the steps that they're taking in relation to the cases that they're seeing just now. Also in regular contact with the Director of Public Health there, Valerie White, who's doing a tremendous job. Dumfries and Galloway is an area that we've been tracking for a week or so, because it's one of the first areas in Scotland that we started to see this rise in cases becoming apparent, and no one single reason or driver for that rise in cases that we're seeing in that area. We're seeing a kind of diffuse rate of increase across the communities there. And again, I go back to the point that I've made continually along here. We all have the opportunity to influence this just now, but just making sure that we take all the steps that we can to try to perhaps look at the interactions we're having with other people, keep those to a minimum just now, to make sure that we're not giving this virus the opportunity to make more bridges and create more infections between people.
Kieran Jenkins from Channel 4.
First Minister, the Scottish Government has a patchy record of disclosing evidence when asked to do so. Can you guarantee to the bereaved families that you will disclose emails, WhatsApps, private emails, if you've been using them, whatever, that nothing will be off limits in this inquiry?
I think if you understand statutory public inquiries, you would know that even if I wasn't prepared to give that assurance, which for the avoidance of doubt I am, then I wouldn't have the ability. This will be a judge-led statutory public inquiry. I think it's also fair to say, I would say it as the First Minister of the Scottish Government, but it's also fact. We're further ahead than any other government in the UK right now in not just committing to a public inquiry, but actually getting it into operation. People will judge the public inquiry as it progresses, and it will be entirely down to the judge appointed to lead it as to how it goes about its business. But as the leader of a government over these past 18 months, and I mean this really strongly, I desperately want every appropriate lesson from what we've gone through to be learned, so that any future government, hopefully not for decades to come, but any future government that is in a similar situation has the benefit of that learning. Journalists' job is to be sceptical and questioning about the intentions of government in this regard, in all regards in fact, but our commitment to this, I think, demonstrated by the speed at which we are moving ahead of others to establish a public inquiry, should not be in any doubt. Joseph Gartley from Bauer.
Thank you, First Minister. One of your advisors, Linda Bald, has raised concerns that the rate of transmission in schools could risk a return to at-home learning, a switch to at-home learning. Is that something you are preparing for, and would the safe return of schooling be far more likely if the JCVI was to approve the vaccine for under 16s?
I think, as I'm sure you've done, Joseph, anybody who reads the totality of Linda Bald's comments, realise that she was not suggesting schools were suddenly about to be closed again, or that was what anybody wanted to see. She was being, rightly discursive about the challenges that are faced right now. I want to keep all of us, all aspects of life that we've managed to get back to normal. I want people to observe basic precautions and mitigations, but right at the top of that list of things that I do not want to see go backwards is the ability of children to be in school. I think all of us have a duty to try to limit the spread of the virus in other ways so that we keep children at school. On the JCVI, look, that's a matter for the JCVI. I have made my views clear. I was very welcoming of the decision to proceed with vaccination of 16 and 17-year-olds. I very much hope that the JCVI will feel able in the coming period, on the basis of the evidence, to recommend that we go further and vaccinate younger cohorts of children. But of course they are our independent advisors on these matters, and it's for them to weigh those decisions up.
Very close eye on all the age groups just now, but if we look at that 0 to 19 age group, we've got about 34% of the cases that we've announced today, for instance, who fall within that age group. The sharpest rise that we've seen within that age group is actually at the older end of that age group, the 18 to 19 year olds, with some rises also in the 16 to 17 year olds. That's something we've got to be careful about. We've got to continue to track, and just to make sure that we're encouraging those people to make sure that they're taking up the opportunity to test on a regular basis as well before going into places like whether that be further education or the schools as well. That's something that we're keeping a close eye on just now, but at this moment in time there's no further action that will be necessary in terms of making these schools safer than they are just now.
Tom Eden from PA.
Thanks, First Minister. All my questions have been asked, so happy to move on.
Thanks, Tom. I much appreciate that. Christine Lavelle from The Sun, who is also here in the room.
Thank you, First Minister. We reported this morning on problems accessing PCR testing in parts of Scotland. Your press office told us that there were difficulties accessing tests in some areas, and people have been directed to other sites, but it's obviously primarily a responsibility for the UK government. I just wondered if you could tell us how widespread the problem is. And just also, if I could ask, you'll know it's the Old Firm game on Sunday and a full stadium has been expected there. There is some suggestion today that the Scottish Government wants Ibrox capacity cut by 40% in light of the surging cases. I just wondered if that was the case.
On the first question, there were some issues experienced yesterday with supply of testing kits at some of the testing centres. That was due to particularly high demand for testing, which is obviously reflective of our case rates. The supply of testing kits does come through the UK government route. We are expecting to see supplies delivered over the course of today, so we expect that this problem will be short-lived and will be resolved today. But of course these are, with case rates rising, these are things that are kept under review and monitored very closely on a day-to-day basis. On the issue of capacity in stadiums, as you know, we still have a capacity limit over which there is an approval process that events organisers have to go through. That's a limit of 5,000 outdoors and 2,000 indoors. Obviously, with football matches for full stadiums, that has to go through that process, and these are decisions that local authorities largely are in the lead on. I'm not going to preempt any decisions that might be taken for events coming up over the next period. Obviously, outdoor events give us less concern than indoor events, but they are not risk-free, and with cases rising, I think everybody can expect that those decisions will be taken very carefully indeed. Helen McCardle from The Herald.
Afternoon, First Minister. I just wondered, I had a quick look at the data before I logged on, and it seemed to me that the cases, or the surging cases that we're seeing in Scotland, is much faster than other parts of the UK. I wondered if that's correct, and if we have any analysis as to why that might be, given that England, for example, had lifted more restrictions than us. I don't know if it's maybe down to things like differences in going back to school or factors like that. But do we have any insight into what's happening there?
So I think, well, contextual point to make is, I mean, Gregor will have more he wants to say here, but contextual point to make is that cases are rising in all parts of the UK. We had a situation in July where we had a steeper increase than other parts of the UK. We talked at the time about the reasons, or the potential reasons for that being that Delta seeded into Glasgow, our biggest city in England. It seeded into cities that are big cities, but obviously in an English context relatively smaller. And there was also at that point, and this was borne out by ONS studies, still lower population immunity in Scotland because we'd had lower case rates at different stages throughout the pandemic. Now, so we then had higher and more sharply rising case rates end of June, start of July. There was also probably a football impact in it at that point. We then saw over the remainder of July and up until very recently, case rates fall quite markedly in Scotland to become the lowest level in the UK. I think we're still just probably the lowest level in the UK, but rising more sharply again. The factors at play right now will be the later, so we are still much more than England. We are still in the sort of impact phase of the 9th of August lifting of restrictions. England did that, 3 weeks prior to that, and they saw a sharp increase then. So they may have tailed off. The other factor is the difference in schools. I wouldn't expect a full impact of our school return to be in the figures yet, but I think we are probably starting to see a bit of an impact there. So it is all just down to the different timing of different factors. I suspect, although this will be borne out or not, hopefully not, if we manage to get this under control, that we're going to see a similar pattern emerge in different parts of the UK, albeit at slightly different times and in slightly different phases.
We appear to be in a catch-up phase just now with the rest of the UK, and I think timing is everything here, particularly in relation to when people take their holidays, when schools are either in place or out of place, and when the restrictions were eased in each of these respective nations, which is absolutely crucial. And at this moment in time, what appears to be happening is we are in that catch-up phase, particularly with England. That you remember that they released a lot of the measures that they had in place a good bit earlier than us, and saw quite a rapid rise in cases at that point in time, which has since begun to slow down. We'll continue to track our cases just now to see whether we get that same slowdown in the kind of acceleration phase as well. But if we look across the UK just now, there's no doubt about it, across each of the nations we are still seeing this steady rise in cases, largely confined to younger age groups under the age of 40, not yet impacting in any serious way on hospital admissions. But it's something that we need to continue to track, and we need to be able to influence just now before it moves into those older age groups. So ensuring that we kind of maximise the opportunities to slow that down just now by just exerting a little bit more caution in the way that we interact with others, by making sure that we're taking all the protective measures we can, washing our hands, wearing face coverings, keeping our distance, and we can influence that at this moment in time.
Michael Blackley from the Daily Mail.
Thank you, First Minister. If you do need to reimpose any further restrictions, should we anticipate that it would be the steps out of lockdown in reverse? I mean, would a first step potentially be re-entering level 0 of the lockdown framework? And also, what does this rise in cases mean for the restrictions that are still in place, particularly in schools? Could it potentially need to be that face masks in schools, for example, are in place for now for a longer period? Thanks.
In relation to your first question, no, you shouldn't assume anything like that. If we had to, and let me repeat again, I hope we don't have to, so I'm not indicating today that is a definite eventuality, but if we did have to impose any restrictions, we'd judge what we thought was appropriate at the time and try to be as limited and proportionate as possible. In terms of the restrictions that are still in place at schools, we said that the basic mitigations in schools would be in place for at least 6 weeks after the return of school, so we're not yet ready, although obviously we monitor on an ongoing basis, we're not yet at the point of formally reviewing what's the case in schools, and we'll keep mitigations in place for as long as we think is necessary to provide protection to young people and staff in schools, but for no longer than we judge is necessary, given how difficult particularly wearing face masks is for younger people in classrooms. What is coming up more immediately is the review of the remaining societal restrictions, which is face coverings in indoor settings for all of us, the capacity limits on events above which you need permission that I spoke about a moment ago, and the requirement on pubs and restaurants to take contact details, and the requirement on all businesses to try to make sure that they are taking appropriate mitigations. Cabinet obviously took stock of all of that today, and I will set out when Parliament goes back next week what the decision is on those. I'm not going to preempt that decision. We will reach a final view ahead of me announcing it to Parliament next week, but I think anybody can look at case rates right now and ask themselves, do they think it is likely that we're suddenly going to say in a matter of days that everybody can stop wearing face coverings, when I've spent a lot of time today asking people to make sure they're wearing their face coverings. These remaining restrictions are, none of us want any restrictions in place, but these remaining restrictions are basic restrictions that I think most people, not everybody, but most people think are worth following to try to keep as much of a brake on cases as possible. Gina Davidson from The Scotsman.
Hi, thanks, First Minister. Just going back to the vaccination programme, we've been contacted by a mum whose daughter falls into the vulnerable 12 to 15-year-old category. The government said that they would, children like that would be getting letters for vaccination, I believe, at the beginning of this month before the schools went back. She's saying that's not yet happened for her. I mean, I don't have any stats saying that's widespread, but I just wondered how much of an issue that maybe is, and whether or not parents with children in that category can make use of the drop-in clinics.
I mean, I don't think there is a widespread problem here, but as we've said, at every stage of the vaccination programme, there is going to be, in any big, complicated programme like this, there will be people who don't get a letter that should have done. Maybe that's because their details haven't been correct on the systems, or the letter's gone astray. So, what I would say is, with the permission of the parent, please pass that on to us so that we can look at it and make sure that the young person gets a vaccination. Drop-in centres are there not just for vaccination, but of course for anybody who wants to go and ask for advice. So I would encourage people to take that up.
I'm not aware of any specific issues in communication in that age group, but as the First Minister says, occasionally this will happen, and we apologise if that's the case. What we do know is that over 1,700 children who fall into this category, 49% of those who are eligible have had the first dose. So there may be the occasional case who slips through like this, but and we'll address that, but by and large it seems to be working very effectively.
Simon Johnson from the Daily Telegraph is the last question.
Thank you, First Minister. As you alluded to earlier, there was very, very high levels of public compliance last year with the restrictions, as people, I think they saw the need for it as the vaccines were developed and then rolled out. Are you concerned you might have a much, much more difficult task to try to convince people to sort of go back to any sort of restrictions or limits on their lives now the vast majority of the population have been double vaccinated? And is there a danger that a large number of people may choose to ignore any new restrictions on, for example, social gatherings because they have been double vaccinated? And secondly, can I just ask about the economic recovery from COVID in northern Scotland? Is it still the plan to fully dual the A96? Thank you.
The position on the A96 is set out very fully in the draft agreement we reached with the Greens last week. It sets out the priority areas to get ahead with immediately, where our two parties have agreed. The full dualling was never scheduled to happen in this term of Parliament. It's still the position of the government, that is the current plan, to fully dual the A96. But as with many things, the recognition, in fact, environmental impact assessments are done as a matter of course with road transport projects. There will be an environmental assessment against climate change targets. But I think the phrase in the document relating to the current plan is there for anybody to see. On the first part of your question, I had a bit of a wry smile to myself as quite within your rights. Of course, your newspaper is one of those who has been, spending some time in recent months, I suppose, questioning the need for some of these basic restrictions to be in place. I'm confident, based on my experience of the last 18 months, that the vast majority of people in Scotland will follow advice and do the things that they know will help to limit transmission. These things are not easy for anybody, and after the best part of 2 years now, they get more and more difficult and people get more and more fed up with them. But that doesn't change the basic reality. If you wear a face covering, you are limiting your chances of passing the virus to somebody else, and vice versa. If you wash your hands regularly, you know that you're limiting the risks of passing the virus on. If you keep a bit of a distance from other people, you're reducing that risk as well. So most people, I think, want to do everything they can to avoid getting COVID. And I would say to people, lots of people now have had it, but it's still something you should try to avoid if possible, and take all the precautions to try to achieve that. And people want to protect those they love, and they want to protect others around them. So yes, I am confident in the collective solidarity of the Scottish people, but I don't underestimate how much more difficult it is the longer this goes on. Gregor, do you want to add anything finally?
Yes, Simon, it's probably a good point in time just to remind ourselves of how this virus has evolved over the last 18 months since it first came to notice in Wuhan. And it really has evolved with the Delta variant in particular into a virus which is incredibly effective at transmitting from one person to the next. I was reading an article in Nature Journal last night, and it was based on a study from China that suggests the Delta variant now has an R0 number of over 6 compared to the original virus, which was between 2 and 4. That shows you just the impact that evolution of the virus has had on its ability to be able to transmit from one person to the next. And of course that has implications for us all, because it is much easier for us now to come into contact with people who are perhaps carrying this virus, and as a result of that to become a positive case ourselves. There's lots of things we can do to try to prevent that. Now, vaccination is still the most important thing that we can do to prevent the infection by this virus. And also, we know it is highly effective at preventing severe disease. But it's not a shield that's complete. And by itself, vaccination will prevent that severe disease, but occasionally infections will slip through. So whether people are vaccinated or not, my really strong advice is that we continue to be cautious. We continue to make sure that we're taking the steps to ensure that people round about us don't get infected if we're carrying the virus, and that we don't come into contact with others who might as well. One of the reasons for that is because we know so much more about Delta now. One of the key things about Delta that's different from the previous virus is the high levels of what we call viral shedding. So it's a marker of infectivity. But the high levels of viral shedding that there are, particularly within the first 48 hours of infection prior to people showing any symptoms. And that really is one of the keys as to why this virus is much, much more transmissible than previous versions of the virus, because it needs much less virus in order to actually infect human cells. And it has this period before people show any kind of symptoms where it's able to replicate to significant numbers in our nasal and our throat passageways and in our throats, and be able to spread to others from there. So simple measures like wearing face coverings, like keeping a distance, like washing our hands regularly, can make an enormous impact alongside vaccination to make sure that we safeguard ourselves and that we protect others as well.
Thanks, Gregor, and that is an appropriate place to end. We've completed the questions, so my thanks to journalists, my thanks to Yvonne for our BSL interpretation, and to Gregor for joining me. Things are much, much better because of vaccination than they were previously, so we shouldn't lose sight of that. We're all living far more normal lives than was the case even just 6 months ago, but as we live those more normal lives, we've got to remember the virus is circulating all around us. It is a different virus to some extent because of the different characteristics and the greater transmissibility of Delta. Tools at our disposal to try to limit its transmission. Vaccination is the most important one, so if you're not vaccinated yet, please do so. But all of these other basic measures, face coverings, washing your hands, keeping a distance, avoiding direct physical contact, staying outdoors as much as possible. These are all powerful tools that we know helps to reduce transmission. So this is a moment, again, unfortunately, where we all have to really up our game in making sure that we are providing as much resistance to this virus as we possibly can. So my thanks to everybody who's joined us today for listening, and please keep doing all of these basic things. We're likely to do another update like this over coming days, so we will make sure that is notified in the normal way. But for now, thanks for joining us.